Hi everybody, Dr. Daniel Demesh here, facial plastic surgeon. Today I wanted to talk to you about how not all fillers are created equal, okay? It's important to know that the most common filler on the market today in the United States is made up of something called hyaluronic acid. And hyaluronic acid fillers are made up of a clear gel-like consistency, and the main ingredient is hyaluronic acid, which is a sugar molecule. It's naturally occurring in our skin, and what it does is it absorbs water and it creates that smooth, youthful, wrinkle-free appearance on the skin and the face, arms, body, everywhere. And as we age, the amount of hyaluronic acid, that concentration in your skin, goes down, leading to volume loss and wrinkles. So that's how and why fillers work. Okay, and there's several different companies that make filler, and within those companies there's several different lines, and it's important to go to a provider who knows exactly what the differences are and why they can be used to your advantage depending on what you're trying to accomplish. Okay, so if we start over here in the Juvederm line, for example, there's Ultra XC and then Ultra Plus. The difference here is that, so for the Ultra XC, it's one of the workhorse fillers. It's good most commonly in the nasolabial folds, in the pre-jowl area, and it's a good workhorse filler. And then the difference in the Ultra Plus line is that there's more cross-linking in those hyaluronic acid connections in those sugar molecules. So it will last a little longer, it gives you more of a lift, so depending on what you're looking for, that's how you would decide. Next, we can look at also a Juvederm line, Volbella, and Restylane line, Kiss, one of the newer ones. So the differences here being that Volbella is good for patients with especially thin lips. It's more of a plumping filler, so it'll absorb more water. It's made with the Juvederm Express technology. And whereas I find Restylane Kiss is good because it has the new Express technology from Restylane, meaning that it moves with the tissues. So whereas before we were looking at fillers to see how much give and how much support they would give to the skin, but now we're more interested in having a more natural looking filler. So filler that not only gives us support to the skin and volume replacing that we're trying to provide, but also moves with muscles, so that if you've ever seen a patient who had lumps or bumps that you can only see as they're smiling or moving their muscles in the face, then that's where the Restylane Kiss line comes in. It has more of that expression technology so that it moves with the muscles under the skin. Along the same lines in the Restylane family, there's also the Refine and Define lines. They are the newer lines as compared to a Restylane L, for example, and using that same expression technology that we saw in the Kiss line earlier. The differences between the Refine and the Define is how much cross-linking there is, and that relates directly to how much support you need. So for example, for Refine would be a good option in the lips where you don't want too much support, you're looking more for water absorption and plumpness. And Define I like for areas of sculpting around the jawline because it gives you more support, and that's what you need along the bony prominences. Okay, moving on to another one. So this is from Reviness. This is a newer filler to the market called Reviness Versa. The difference here is that for the Versa line, the hyaluronic acid crosslinks are less artificial, and they try to keep the molecule in its more natural state. And what that means for you is that the studies have shown that for patients injected with Reviness Versa, that there's less swelling after you get the injection, okay, significantly less swelling. So it's really nice for the lips, especially when you're looking for a subtle enhancement and not too much water absorption. And it's also a good workhorse filler for the mid to deep dermis and other areas around the face. So those are some examples of what some differences are and why it's important to know what's on the market and how it can benefit you, okay?